Hi, I am
I'll go. Okay. Hi, I'm
not so Dr. Aaron,
and I'm not so Dr. John.
and we're here to talk about the high.
Oh, maybe it's like high angle. No, that's.
Hiatal hernia. That is what we're here to
That's
talk
it.
about with us today.
Yes.
A digestive disorder. Now, what is this digestive disorder? Okay? A condition in which the part of the stomach, or rarely another abdominal organ, pushes through the diaphragm. Example, okay, of a rolling one. So, the stomach, when the diaphragm is weakened, sometimes will push through the diaphragm. So this is an example of a rolling hernia, okay? This is what a normal stomach looks like. This is what it looks like as a rolling one. You can see that it's going through the diaphragm that's labeled right here. Now, there's another one that's called the sliding one. And it's this, where basically the stomach, instead of just poking through the diaphragm, it slides back up the esophagus right here, as you can barely see on your phone. But it slides up through the esophagus where it kind of makes this little like lump here, where it makes it really hard to do things. And this right here is an example of one where it's kind of like both mixed with each other. So it's sliding through and also poking through at the same time. That's why it's kind of just like massive, which probably is not good for your health or mental being.
And sometimes the diaphragm can get weakened because of age-related issues or increased intra-abdominal pressure, like obesity or pregnancy, and also possibly some congenital tissue weakness. All right, so now we're going to talk about the organ or organ systems affected. First one is the esophagus. It's usually posterior to the stomach, or the lower esophageal sphincter, the LES, and those two are critically involved. Obviously, the stomach is affected because usually that's is what herniated, and obviously the diaphragm because that's what it goes through when it's weakened, and just in general, like the gastrointestinal system.
Signs and symptoms, okay? Some people have no symptoms at all, and that sucks. But then some other people may feel a heartburn, chest pain, or acid coming up, which is not good. You also might feel quickly bloated or nausea after eating, which that's also not a good feeling for you to have. So probably go get that checked out if you do. Big hernias can cause trouble swallowing or shortness of breath.
That's the worst one. All right, the lasting effects. If you have ongoing acid reflux or GERD, that can hurt your esophagus that cause sores or scarring. It can also lead to a condition called Barrett's esophagus, which also slightly raises your cancer risk. And then the large hernias can also cause stomach bleeding or even block food from passing through your esophagus, through peristalsis, which also sucks. And if it gets really, really bad, people need surgery, which is also bad.
Treatment, okay? Lifestyle changes, lose weight. Eat smaller meals. Don't lie right down like on your stomach after eating, okay? And stop smoking. Even if you don't have a hernia, stop smoking. Like this guy. Okay. Medicines like antacids, H2 blockers, and protein pump inhibitors can cut down on acid. Surgery only if symptoms are bad or if the hernia is large. Okay.
And then we have the experimental possibilities that people are trying to figure out right now. So we have like magnetic rings that can keep the acid down when you have a hernia. Also better surgery tools using robots like the Da Vinci that lower the risk of that hernia coming back, like using meshes and stuff like that. Or some endoscopic options, and doctors might use new scopes that tighten the area where the hernia is without a bigger surgery. All right, so now we have some diagnostic tests used. We have 4 of them. We have the endoscopy, barium swallow, a manometry, and a pH test. Pretty much this endoscopy is like a small camera that goes down through your esophagus to your stomach to see if you have anything wrong there. A barium swallow, you drink a chocolate liquid and they can see through an x-ray. A manometry measures how strong your esophagus muscles are. And a pH test, obviously, checks to see how much acid comes up when you swallow.
Dietary changes. Eat small meals and avoid lying down for 2-3 hours after eating. Avoid greasy, spicy, or acidic foods. And also cut down on caffeine and alcohol, like this guy. Raise your head of your bed to 4 to 6 inches if you get heartburn at night. And try to lose weight if needed. Wear loose clothes and keep pressure off your stomach. Thank you for joining us on how to learn about the hiatal hernia. I hope you enjoyed our lesson today, and we'll be back soon with another probably presentation on different topics.
That's it. No, that's it. That was on episode, Brad. Bye, guys.